My dental history goes back to when I was a young child because I had some medical issues and they gave me tetracycline, which is pretty common for people my age back in the day. And so I had some yellowing, discoloration, and your teeth get soft. So really I had dental issues from the time that I can remember. I had my parents take me, so at some point you go to the dentist because you're taken to the dentist, but then as an adult you have to make that choice to go. And I tried a number of different dentists, but never really followed through with the care.
We try to break that cycle. Just because you've had bad dental experiences or bad things happen to you with your teeth doesn't make you a bad person. We start with listening and understanding, and we try to do things to limit the risk of things going wrong again.
Well, I had a high anxiety level, and I guess it really wasn't based on anything that was realistic, but I couldn't control it. So it was the whole heart racing, anxiety, nervousness, worried about the pain that you might experience, just the sensation of, having someone working in your mouth and fear of choking. I mean, I think I ran the whole gamut because my brain would just kind of cycle through all the things that worried me. But with Dr. Thaney, it's the whole environment, it's the whole culture of the office that makes a difference. So when I had trouble with that gag reflex that we talked about, I had the first mold here, did go very well, we stopped in the middle of it. And then the next time that I came back, they had developed a new way to do it. They had thought about it and come up with a new way. Position me different, fill the molds differently, and I got through it with absolutely no problem. So even though I was nervous, it worked perfectly. So they take the time to do that.
It's amazing what ideas my staff will come up with every day. I'll come in and they'll say, hey, why don't we do this for a patient? Or why don't we come up with this type of thing? Wouldn't patients love this idea? And I'm just blown away.
One thing that's unique about Dr. Thaney is he's willing to take the time to come in and talk to you first. Before I went through the procedures that I had done, we met probably 6 times. We just talked. Dr. Thaney would explain what the options were. I met everybody in the office. I felt more comfortable just coming in through the door because you get used to the environment.
My goal is to make everyone feel comfortable. I want them to be part of the practice. I want them to feel like they're part of our family. We treat every person and every patient and every teammate with the same kind of integrity and respect that everyone deserves.
Well, before I had it done, I was very shy in terms of interacting with people, but I'm a talker, so it was really a conflict for me. So I spent a lot of time talking like this. I think Dr. Thaney even noticed that one day. He's like, your hand isn't over your mouth. I would talk like this, or you would kind of turn your head, or you didn't really look at people and engage them. And afterwards, at first I felt the same way, but then people started to say, wow, did you whiten your teeth? Or, oh, you look great today, or make comments that make you start to feel that confidence. Even in the pictures, when I look back at my kids' high school graduations or things, I was never smiling. I was always hiding my teeth. So now my pictures are different, my outlook is different, my interaction with people is more confident.
Our tagline fits us perfectly. We want to try to make everyone as healthy and happy with their smile as possible.